With HPV being the new way that we're going to do the Ontario Cervical Screening Program, we're going to have a more accurate, more precise test that we can offer to people with cervixes so that they can get the care they need earlier and more accurately than before, and also reduce the harms in terms of not having to do referrals when not necessary. It's still a pap test in the sense that you still have to go see a clinician and they're going to do a swab of the cervix for anyone who does have a uterus. It's still the same brush that we use, but it's the test that's run on the back end that's going to change. So before we were looking under a microscope at the cell changes, that introduced more subjective aspects of who's reading it, what their training was, things like that. Now what we're doing is we're taking it a step further ahead of the pathophysiology and actually looking for the infection of HPV. And that's going to tell us, hey, do you have HPV? What type of cancer-causing HPV do you have? And then we're going to look at the cells afterwards, because majority of cervical cancers are caused by HPV. And we're hoping now that we're increasing that awareness of HPV as the virus that's causes, which we've known for quite some time. That's also going to help encourage more vaccination against the HPV virus. People are eligible for the HPV vaccine at a young age. Public health offers it from grade 7, but you can get the HPV vaccine all the way into adulthood. So if you read the monograph for the HPV vaccine, it does say that it was studied up till the age of 46. But if we look at the section of Gynecologists of Canada, they actually say there is no upper age limit for getting the vaccine. And so I'm encouraging everyone to get the vaccine no matter what your age is. So historically, going back all the way back to the beginning of the OCSP program, it used to be 18, then it got changed to 21, and now we're changing it to 25. As we're learning more and more about the disease, we're learning more about how the virus interacts with the human body, we're understanding that sometimes our bodies can clear it, but sometimes it can't. And so what we're doing is we're saying, hey, we know your body could clear it. So we're going to start at 25, because those who do have the HPV virus at that stage, we should be looking for it. The cancer is caused by persistent infection. I think that's key. And it takes years for that infection to turn into cancer.
Right.
But what we want to make sure is that we're catching it when somebody's not feeling the symptoms. There's no point in waiting until you start feeling symptoms, because it could be too late at that stage.
Right.
And so the whole reason getting a screening test done is that we capture it early when you're not feeling symptomatic, and that we can intervene at an earlier stage should the cells change. Screening is still important. Repetitive screening is really important. We are changing the interval between screening. So for somebody who is who's healthy in body, it's every 5 years now. So we're making it less stressful. But it doesn't mean that it's any less important. So please do reach out, get screened, find out what your HPV status is, get vaccinated, because all those things add up to living a long, healthy life. So the test that we're offering here in Ontario is checking for the cancer-causing HPV. Just because somebody might come back with a negative HPV test does not mean they don't have HPV. HPV also causes warts, and so when you do get that HPV negative test, it doesn't mean that you're immune to all types. And on top of that, just because you've cleared HPV once, it doesn't mean that you're immune against all the different strains of HPV. And so it's still important to get screened on a regular basis. It's still important to get the vaccination. And just because you got vaccinated doesn't mean that you shouldn't get screened with a pap test. It is just as important. It just means you were better protected at that stage.